Hello, everyone. Welcome to today's discussion on depression.
Only.
Yeah.
We see in our country there is so much stigma associated with mental well-being. And
Yes.
especially when it comes to depression, people say that, oh my God, you just can take care of it. What's the big deal? All of us experience. I think the
Yes.
depression is something very commonly used word now. So people don't really understand how do you differentiate sadness from depression. So I think I would little bit want you to focus more on that. How do we differentiate sadness from anger? One, you said that yeah, it lasts for shorter period of time, and it's
Mm.
not like depression which continues for the whole day throughout 2 weeks. What are the other ways that we can differentiate sadness and depression?
So, I mean, you mentioned about stigma, so briefly I'll talk about that. And I think psychologists are less subject to stigma than psychiatrists. Psychiatrists are always seen as being doctors with, with white coat and pen in the hand with which they write medicines, and they give you so much medicines that it literally starts to pop out of your eyes, and you're left good for nothing other than popping pills, and that as I think damaged a lot of the mental health arena, where psychiatrists are giving haphazard excessive amount of medicines. Many require treatment, but I think sometimes it's over treated, and psychologists are, on the other hand, not seen as that much medical, which is good from mental health arena, that people want to talk to psychologists and uh, befriend them, and start to explore the problems. So you guys do a very good job, uh, but there are, coming back to the differentiating between the two, as I mentioned earlier, that one of them is normal emotion, other one is an illness. And when the normal emotions are unattended, say for example, during the lockdown period, everybody is feeling the sadness and the blues. Almost everybody. I think more than half the country, 60, 70 crore people, I would estimate, or more even, are feeling the blues of continuous lockdown and uncertainty, and emerging difficulties and catastrophic news. When the sadness and the depressed mood is last for continuously, but the sadness and depressed mood or depression will also present differently. For example, if when people are stressed, they'll be irritable, uh, they'll be they'll have low threshold to getting angry, they'll have poor quality of communication, they will be oversensitized. In India, I think most of the people that who are stigmatized and don't want to see a psychiatrist do come to us with the principal problem of having poor concentration and unable to remember. We are so brain obsessed. We want to remember everything. So people come with memory impairment to say, I can't concentrate and I can't remember things. I could remember phone numbers, I could remember charts, I could remember numbers, and I can't remember them anymore. Very common. Then you see people becoming cynical, people becoming very pessimistic, people, even leading to bullying of each other. You start bullying your colleagues, because you're cynical, negative, and sarcastic. Then you see, and a lot of these, unidentified depression are presenting in the form of domestic violence. We saw during lockdown that there's this enormous surge in domestic violence. And what are they? They are emotional problems, many of them unattended, and now manifesting as behavioral problems. And with behavioral problems, I would tell you that people can present with anger, people present with irritability, and also they start to present with substance abuse problems. So people, when they're emotional and depressed and negative, they drink more to get a quick fix and to get high. They take more drugs. Many people who smoke, they smoke more, or some people over the counter go and buy medicines to calm themselves down. So self-medication with alcohol and drugs, and even over the counter unprescribed medication, is very, very common. So you tend to see all these things, and between the two, we see the degree and the number of symptoms that we talked about. One is might come in patches and come and go, come and go. For example, in 3 months of lockdown, you might feel gloomy for a few days, happy for a few days, gloomy for a few days. You're making effort. In depression, that patches will become longer, the intensity will become higher, and the efforts will go down. So person stops making effort to sleep better, to eat better, to do things that will make them feel better. That's when it becomes a clinically significant condition. And if such a thing is happening, then you need to sort of start to take account to say that, can I manage this on my own, or do I need help? Can I get a psychologist or psychiatrist to talk to me about it? If you have a good family member who can lend you a good ear without talking and interrupting, you can talk to him. See whether more needs to be done.
I think you highlighted very important points with regards to even thought.
Yeah.
People they tend to lose concentration, and also that was one of the questions that has come to us. That what about deterioration in concentration, of course, which can also be seen as a part of depression. So in depression, people find it very difficult to concentrate. Their day-to-day life gets impacted. So
Yes.
but in sadness, that is not so. Your day-to-day life doesn't get impacted. You are still able to function well.
Indeed, absolutely. As you carry on with life, you feel, and one of the typical points in depression, as you quite know as well, is that people tend to feel worse in the mornings. So what we call is diurnal mood variation, which simply means that you wake up in the morning feeling gloomy. People who have lifestyle-related stresses and mood problems, relationship-related issues. So you wake up happy, and then it gets worse. In depression, you wake up gloomy. The worst time of the day for a person with clinical depression is in the morning. Whereas if you have circumstantial or relationship or problem-oriented mood changes, then you tend to see that more later in the day. So if somebody has morning symptoms, then alarm bells should start ringing to say that this is gone a bit too excessive.